You're watching Take Two.
The COVID-19 pandemic is affecting everyone with the stay-at-home mandate, especially our keiki. The stress level of not seeing their friends at school and being cooped up at home can really take its toll. So how do you help your kids adjust and make it a teachable moment? Joining us this morning is psychologist Dr. Alana Coffey. Good morning, Doc.
Good morning. Hi, Ross.
How are you doing?
I'm good. Thank you for asking. And
Now-
thank you guys for still being on air.
Now, first off, how do we explain to our kids what's going on with the coronavirus? Because it's all over the news and social media.
Right. Okay, so first of all, I think we should do it calmly and reassuringly. And please, let's remember their age. The teenagers are very different than the people who are 10 and under. Teenagers are getting a lot of their own information, but the 10 and under still need us to sort of frame the narrative. And I'm a great fan of telling the children the truth in stages. Don't expose them to too much light. It's searing, but in little bits, we give them the facts about it. So we can first start off with its name. I did not know that COVID-19 was coronavirus disease 2019, and that they're still learning a lot about this disease. And so I think that's important that the children even know what it's called, and that they know that there are really smart people who are studying every day and night, trying to find out everything they can about this particular disease.
So you give them the facts. Also, do you watch for their reaction when you're trying to explain to this and how they're feeling?
Absolutely, and validate those feelings. Some children don't seem to be as upset as we think they should be, and that's okay. And some are far more upset than we think they should be. So validate their feelings however they feel. It is okay. It's justifiable. But again, we give them enough information so that they can make sense of it. The disease did make a lot of people sick across the world, around the planet, and that's one of the reasons that we are doing some of the actions that we're doing here at home. So in addition to giving them the facts, we give them an empowering and hopeful message that they, even though they're little, can do something. And some of the things that they can do about that are staying at home. And while they're at home, not getting into a fight with their sister, or while they're home doing their homework, and but we can also just in our own little parts try to make this as hopeful and encouraging as possible for them.
Any final tips for parents in making this a teachable moment?
Taking care of the inside of the house first, your hygiene, your sleep, reduce the germs, and then just like a raindrop rippling out, then we think about our neighbors and our kupuna, and we do what's good for them. And then a drop rippling out, and then we think about our community, our neighborhood, our state, country, planet. And so it's sort of like a global ripple starting from the inside out. And we start with the young people by inspiring them and empowering them on the inside.
And it's also a teachable moment in terms of washing your hands, correct?
That's what I mean, what they can do each and every day. And they might be thinking that's not enough, but, again, if parents use charts, reward, visual, tangible systems, they can start seeing, every time they wash their hands, we ring a bell, for example. Or I know a lot of people who are setting alarms, and those alarms are reminding them to wash their hands and to wipe down the house and things like that. Those are things that are tangible and measurable for children, and that works really well for 10 and under.
All right, there you have it, Dr. Alana Coffey. Some great tips, and thank you again for your time, because it's a teachable moment for everyone, from the kids as well as the parents, correct?
Very much so. And if you get stuck, call us up, Honolulu Psychology Collective. And that's even for people who may be out of work or may not have insurance or not sure about what their insurance can do. Call us and we'll help explain all of that, because the parents have a lot of stress and they need someone to talk to. I do not recommend that you talk to your children about your stress, because, we're fighting both COVID, which doesn't actually affect children, but the anxiety that we feel does. So if you're feeling that, call us up and we can help.
All right, there you have it, Dr. Alana Coffey.
Thank you, Ross. Be well.
You too.